Welcome to Healthcare Champions. I'm Shelley Sanders, and today we are talking all about the ears, nose, and throat. And I can't think of a better person to talk to about it than Dr. Scott Powell with Florida E.N.T. and Allergy. Welcome to the show.
Thanks for having me.
It's such a nice, refreshing thing to talk to you about the ears, nose, and throat because we live in Florida where I don't think I know anyone that doesn't have allergies or suffer from them at least one time a year. And that is all year,
That is
all year, really and truly. And again, I'm just preaching to the choir here. You're the doctor. So let's talk about it. How long have you been around and how many locations do you have?
I've been in practice almost 12 years now. I was number 4 in the practice. Now we're up at 25 with 13 locations. So we've grown exponentially.
Yes, 13 locations in the Bay Area. So chances are if you're watching the show, there's a location near you if you need some help. And certainly if you need any help on what we're discussing today. So let's talk about it. Talk to me about, and if some people out here are going to feel me really hard when I say snoring. When do you know it's just snoring or sleep apnea?
Well, that's the big separation. So I always tell people snoring is annoying to other people. Sleep apnea is annoying to you, to your body. So snoring, the big thing is snoring is loud, vibration of tissue, whereas apnea, you actually are completely closing off the airway. And so that brief moment of time, you are suffocating. And your heart and lungs feel that, and that's the problem.
Now, with that, I think, okay, now you're suffocating. Is there permanent damage that could be caused as a result of untreated sleep apnea?
Yeah, there's significant heart and lung strain. So you can get pulmonary hypertension, you can get eventually lead to heart failure. Now that's down the road away, but we've heard of a few celebrities who have gone through that. So that's a very untreated diagnosis and problem in America for sure.
Unbelievable. So when do you know, okay, so this is snoring. What are some of those things to listen for or watch out for? When do you know, yeah, this is more than snoring?
Yeah, so snoring is just a loud roar and it pretty much continues and it's somewhat location dependent in terms of position. Apnea tends to be more where the snoring will occur and there may be a pause in breathing or a grunt or a gasp or reawakening. You think the patient's actually waking up over and over because they kind of are. Their body's taking them out of deep sleep back to almost awake. They try again and they keep failing all night.
Wow, and anyone that's ever been sleep deprived knows that you can't continue to function in that aspect. It makes you a little bit crazy. So, okay, so those are some of the telltale marks to look out for or pay attention to, both personally and if you're a loved one that has someone that's stopping breathing. So how much of a 911 is this?
So they will rebreathe. That shouldn't be an urgent situation right then and there. The key is if they come into the office, we can evaluate them to figure out why this may be happening. So there's certain blockages that can happen in the nose, in the throat, in the tongue, for example, that can really cause this problem. And if we can isolate those things in the office, then we can really steer them towards just a snoring remedy or maybe they have sleep apnea. And the beauty now is the sleep apnea test, which used to be a hassle going to some lab somewhere, it now actually can be mailed to your house and done at home, which is hugely convenient.
Yeah, for sure. So, okay, it sounds to me, if I'm understanding you correctly, there's different types of sleep apnea then. So there's some that maybe have a physical ailment versus another?
Well, by definition for the obstructive sleep apnea, which is what we deal with, there's a central version, which is the brain is just doing it on its own, which is not necessarily an ENT issue. That's more neurologic.
But you'll discover it, though, once they come to you, though, right? And then you create that game plan of where to go.
Correct. So the obstructive version is much more common. So the nose blocks off for whatever reason. Maybe it's their deviated septum, maybe it's severe allergies, maybe it's bad sinus infections. So that stops working. They start mouth breathing and the snoring begins. And then from there, the tissue just collapses because it runs out of room, and that's when things close off, and that's when the apnea happens.
Wow. Now, are there other, what are some of the treatments that you can get done for that?
So by and large, the gold standard is the CPAP or the machine that people talk about. So there's a lot of varieties there when we help set that up if need be. But from a surgical standpoint, if we can find specific obstructions, there can be some surgical remedies. And some of the newer things, which are really cutting edge that we're doing, whether it be oral appliances or even more importantly now, there's actually a nerve stimulator to the tongue to allow it to stop falling back in our airway when we breathe. And that's really, really impressive.
Unbelievable. So many strides that we're making in medicine. It really is fascinating. So many things that we could talk about. I absolutely love the fact that you guys do all that in-house so you can really diagnose, If it needs a scan, you can do that there. So you're not having to run all over the Bay Area, depending on what time of day it is and what kind of transportation challenges you have. That can be a big issue, right?
Right. So the key with us is we don't want patients to have to go all over, like you mentioned, the county for tests and exams.
Sure.
So once they get their home sleep study, for example, and they come back, we can pretty much come up with a plan right then of what they will need going forward, and that's a wide variety from there.
Love it, and I'm sure you just hit a hot button for a lot of people, and they're probably wondering, how do we get in touch with you, Dr. Powell? So why don't you tell them?
Probably the easiest way is our website, so it's Florida E.N.T and Allergy.com, and from there they can see our locations, our procedures, and call the phone number for an appointment.
Beautiful.